right, my name's Chelsea. I'm going to be giving you SBAR report going off today. Okay, so this is Mr. Pablo Rodriguez. He's a 62-year-old male that was admitted with a urinary tract infection or UTI.
Okay.
He has a history of type 2 diabetes and also hypertension. So they have ordered vital signs and blood glucoses on him. I just got those and I put them in SimChart for you.
Okay.
He has no known drug allergies, and we're just doing a couple meds to try to get him better. So it's 8:30 in the morning and I'm leaving, so it's time for you to give his meds.
Perfect. Thank you.
You're welcome.
Okay. So I'm going to come over here and I'm going to obtain my MAR and I'm going to determine what medications need to be given. So the current time is 8:30 is what Dr. Andrews told me, and that is correct on here. Okay, so I see we have a lisinopril tablet that is due at 9 o'clock, so I'll give that. We have a metoprolol tablet that's due at 8 o'clock, so we will go ahead and give that one too. We have regular insulin and NPH insulin, both due at 7, but I can see that they weren't given, so I'm going to give those as well. And then the last one I have here is ceftriaxone, which is Rocephin. That's an antibiotic. It's IM, and it's due at 9 a.m. So if I was not familiar with any of these, I would go ahead and look them up, but I am pretty familiar with all of these. So I've got 2 blood pressure medicines and an insulin. So I would like to look and see what those were this morning. So I can look and see his blood pressure was 155/93 and his heart rate was 96. So I feel comfortable giving those blood pressure medicines. And I can see his blood glucose was 215. So I feel comfortable giving his glucose. I do need to make sure, since it's got some PO medicines, that he's able to chew and swallow. And since I'm giving some insulin, I want to make sure his tray for breakfast is in the room. And I can see here in SimChart it says he has no allergies, and Dr. Andrews told me he did not have any allergies, but I just want to confirm that with the patient. So I'm going to come see the patient real quick. Hey, Mr. Rodriguez.
Good morning.
Good morning, Mr. Rodriguez. My name is Jennifer. I'm going to be your nurse for today. I've got some morning medications for you. I have a couple of questions for you, if that's all right.
That's fine.
One of them is going to be some by-mouth medications. Are you having any problems swallowing today?
No, I swallow fine.
Great, okay. And I also have some insulin for you. Is your food tray here in the room? Are you ready to eat?
Yes, I'm so hungry. It's right over there.
Great, okay. Well, and I also saw on your chart it said you had no allergies. Is that correct? Are you allergic to anything?
I'm not that I'm aware of.
Okay, great. Give me just a few minutes. I'm going to go get these medicines ready, and then I will come back and see you, okay?
Okay, thank you.
Okay, great. Okay, so now I'm going to click back into my MAR. And I'm going to unplug this from the wall. I'm going to come over here and I'm going to start preparing my medications. So the first thing I'm going to do is wash my hands before I start preparing. And I see my ceftriaxone. It's ordered 600 milligrams. And so in just a second, I'll have to do some math on that one. So I'm going to go ahead, I'm going to do my first MAR check as I pull all the medications out of the drawer. And I'm just going to start at the top and work my way down. So the first thing I have is lisinopril. So I have lisinopril. It's 5 milligrams. These are 2.5, so I have 2 of them. It's oral. They're due at 9 o'clock. They're due now, and they are not expired. Okay. The second thing I have is metoprolol. Okay, this is 50 milligrams, this is 50 milligrams. It's oral, it's due at 8 o'clock, and so we're gonna go ahead and give it, and these are also not expired. Okay, the next thing I have is insulin. Okay, I need regular insulin. I'm gonna give 5 units, so I'll have to draw that up in just a second. It's subcutaneous. It's due at 7, but it's not been given, so we're gonna go ahead and give this, and it is not expired. Then I have NPH insulin, and I'm going to give 5 units. I'll have to draw that up. It's subcutaneous, due at 7, and it is not expired. And the last thing I have here is ceftriaxone. I'm going to give 600 milligrams. This is a 2-gram vial that I'm going to have to reconstitute, so I'll have to do some math. It's intramuscular, It's due at 9 a.m. and it is not expired, okay? So that is my first more check. I'm gonna get a pencil and a calculator, and I'm going to do a little bit of math. So my ordered dose is 600 milligrams. That's my desired. This says it's a 2-gram vial that I reconstitute with 10 milliliters of normal saline for a final concentration of 200 milligrams per ml. So that's the numbers that I need. So it's going to be 600 divided by 200 times 1. Okay, and those will cancel out. So it's going to be 600 divided by 200. So that is 3 milliliters. So that tells me I'm going to have to put it in the ventrogluteal, so I will need a little bit bigger needle. Okay. So now I'm going to get all the supplies that I need. I need 2 cups for my 2 oral medications. I need some labels, Band-Aid and cotton ball, a good bit of alcohol. I'm going to get injection pads to give my shots with. I need a cup and a straw for him to swallow the pills with. Okay, insulin syringes. I only need 1. I may get 2 just in case I bend a needle, which I've done before. Okay, I need some normal saline to dilute the Rocephin with. I'm getting 1 of the 1.5-inch long needles to give my shot with. Then I'm getting 2 of the 1-inch needles to draw it up with. Then I don't need anything on this drawer. Then the very bottom, I'm going to get a small 3 milliliter syringe for my injection. I'm getting a 10 milliliter syringe to draw it up with. Okay. So now I'm going to come over here and I'm going to do my second more check as I prepare the medications. Okay, so the first one that I have is the lisinopril. So I'm checking again. Lisinopril, it's 5 milligrams, so this is 2.5 plus 2.5 is 5, oral daily. It's due at 9 o'clock. It's not expired still, and I am going to put it in this cup. And I know that I'm supposed to keep all my medications that require pre-assessments separate in a separate cup. And I'm going to put this right here. And since it's still in its original packaging, I'm not going to create a label. If I was doing more than one person's medicines, I would fill out a label with the patient's name and what that was. Okay, so that is my first one. My second one is metoprolol. It is 50 milligrams. It's 2 times a day. It's due at 8 o'clock. It's by mouth. It's not expired. It's going into this cup right here. And like I said, I've already checked their blood pressure and things like that. Okay, so the next thing I have is my regular insulin. Okay, that is 5 units subcutaneous, due at 7. This is not expired. And I'm going to mix it with my NPH insulin, which is the next one that I have. And it is also 5 units. It's subcutaneous and it is not expired. I'm going to roll this NPH between my hands to get that good mixed up. And I've got 2 alcohol prep pads. I'm going to clean off that regular really well. Clean off this NPH really well. Okay, there's 5 units of air into the cloudy. 5 units of air. Into the clear. I'm going to draw up the clear. Hey, Dr. Andrews, will you come check?
Yes, 5 units of
5 units of regular, so that is correct. And then my other one is, again, 5 units of NPH. So I'm going to put this in right here. Okay, Dr. Andrews, will you come check this right here as well?
Yes, 5 units of NPH.
Okay, so now I've got my total of 10. Okay, I'm going to recap this just with one hand. Okay, this one I do need a label for. And so this is PR, his birthday is 7/15. This NPH, 5 units, regular, 5 units. And I just realized I forgot to grab the barcodes out of the drawer for him. So this is a sticker for regular insulin. Okay, that's right. And this is a sticker for NPH insulin. I should have grabbed those earlier, but that is okay. Okay, and then my last medicine I have is the ceftriaxone. I'm gonna keep this because it has the barcode on it. It's a 2-gram vial. I need 600 milligrams. It's going to be IM. I've already done my math and know I need 3 milliliters, so it's going to be ventrogluteal. It's due at 9 o'clock, and my instructions say dilute with 10 milliliters of normal saline for a solution of 200 per ml. So I'm going to take the tops off of both of these. They should be clean underneath, but just in case, I'm going to wipe these off. Got my 10 milliliter syringe, one of my 1-inch needles, this is 10 milliliters of air into the saline. Okay, and it doesn't have to be perfect, but I want it to be 10. Okay, and this is my Rocephin. I'm going to inject 10 in here. I'll let the pressure depressurize on the syringe so it doesn't squirt everywhere. Close this needle. Roll it between my hands to mix it. My computer went to sleep. Let me open this back up. So I have my MAR ready as I finish my second MAR check. Okay, so now I have my smaller syringe, and it's still just a 1-inch needle. Screw these together. If I'm afraid I touched it with my hand when I rolled it, I can wipe it off again. Okay, now I'm going to get 3 milliliters because that's what my math said. Inject into here. I'll pull these up. Drew up a little bit more than I need so I could have some extra to tap out in case I had bubbles. Dr. Andrews, will you look and see that this is 3 milliliters?
Yes.
Okay, great. So I'm going to close this needle. And I'm going to trade it out for my 1.5-inch needle is what I'll use to actually give it. Okay, and if I had forgotten to do my second check as I was preparing or talk about it, I could do that again with all of my prepared medicines, but I have done my second check. So I'm going to take all this trash, put it into the trash can. This is glass, so it is going to go into the sharps. Needles and syringes into the sharps. I need to label my Rosethin. This is PR. His birthday is 7/15. This is ceftriaxone. 3 milliliters, which is 600 milligrams. I'm going to leave it right here with the barcode that belongs to it as well. Okay, so I can put this back. To go with me, I need my injection pads. I need this alcohol. I need this. I don't need this extra insulin needle. And then I can put my 2 stock insulins back into the NPH drawer and into the regular drawer. Okay. So now I'm ready to go to my patient's room. So I'm going to come this way.
Come in.
Hey, Mr. Rodriguez, it's me, your nurse Jennifer again. You doing okay?
Yeah, I'm good.
Great.
Just hungry.
Yeah, I've got some insulin for you. You can eat right after that, okay?
Alright.
Got your morning medications. Will you tell me your name and your date of birth, please, sir?
Yeah, Pablo Rodriguez, 7/14/19XX.
Excellent. And you're not allergic to anything again, correct?
Not that I know of.
Okay. I'm going to do my 3rd check of the MAR here at your bedside and just tell you all the medicines I've got for you, and you can let me know if you have any questions.
Okay.
So the first one that I have is lisinopril. That's a blood pressure medicine. We've got 5 milligrams, and our pills are 2.5 each. So I've got 2 of those for you. And then I have metoprolol, which is your other blood pressure medicine and for your heart. It's 50 milligrams. It's oralized to you now. I've got some insulin for you. They're mixed together. I've got 5 units of regular insulin and 5 units of NPH insulin to make 10. And then the last one I have is ceftriaxone, which is your antibiotic shot to give you in your hip. Okay. Do you have any questions for me, Mr. Rodriguez?
No, I'm good.
Okay. Do you know where the last place they gave you your insulin shot was at?
It was down in the lower part over here.
A lower part of your like abdomen?
Yeah.
Okay. Is it okay if I give it in the back of your right arm just to rotate the sights out?
Yeah, that's fine.
Okay, great. And then what about, do you remember which hip they gave you your last?
Oh, I remember it's sore. It was my left hip.
Okay, well, I'm gonna give it on your right hip. Is that okay?
Yeah, that's fine, I guess.
Great. Okay, so I'm gonna click this green dot for the lisinopril. I'm gonna start with just your pills. Is that okay?
That's perfect.
I'm clicking patient ID. I'm gonna scan your wristband. Okay, and that got it. And then this is your 2 lisinopril blood pressure medications. Oops. I didn't click in medicine before I scanned. Okay, great. And I've got just water for you to swallow with. Is that okay?
Yes, that's fine.
Okay, I've taken these out of their little Ziploc bags. Oh, raise your head up just a little bit for you. Is that all right?
Yes.
This bed squeaks. I'm sorry. Okay, is that good right there?
That's perfect.
Okay, great. Okay, so like I said, this is the 2 lisinopril. Okay, you need some water. There you go. Okay, great. So I'm going to put the administration time and my initials. And click save since that's given. Okay, so the next one is metoprolol, which is your other blood pressure medicine. So I'm going to medicine. Scan the medicine. Okay. Okay, I'm gonna take this out of its little Ziploc bag. Okay, got one more pill for you, okay?
Okay.
There you go. Thank you, sir. Okay, I'm gonna put in the administration time. I'm gonna type in my initials. Click save. Okay, great. So the next one I've got is your insulin injection. Okay, so I'm gonna put some gloves on to give you that shot. Okay, and Dr. Andrews, where I'm gonna pick to give it is like in the fatty part in the back of the arm, like right back here. I'm gonna pinch it up, but I'm gonna actually give it into this injection pad over here. Okay, so I'm going to click on the insulin. It's yellow. That just means it's late because it didn't get given before the breakfast tray. Okay, and then scan him. And then my insulin barcode. My barcode is a little bit messed up, and so thankfully they have, in case of emergency, printed off some barcodes here for the regular insulin, so I can check to see if that one works. Okay, that one doesn't work either. So in the interest of finishing my check off so I can get past, I'm gonna click the button that says proceed without barcode scanner. Okay, I'm gonna come over here. This one is sub-Q. So I've got my gloves on, I've got my alcohol. I'm gonna wipe it in a circular motion from the inside out. Let that dry. Okay, I've got bevel up. Okay, and I'm gonna inject this at a 45-degree angle. Are you ready, Mr. Rodriguez?
Yes.
Okay, ready, 1, 2, 3. Okay, in, inject it out, okay. I'm gonna push this safety up. Okay, and that shouldn't need a Band-Aid or anything. Okay, and then I'm gonna put the administration time. And then I'm gonna put my initials. I'm gonna click save. And then the last one we have is your ceftriaxone. So that's your injection. So I'm gonna raise you up a little bit. And we say we're putting it in your right hip. Is that right?
That's right.
Okay. So I'm gonna just turn you over and I'm gonna show my teacher where I'm gonna put it in at, okay? So we're gonna roll over. Okay, so I'm gonna put my left hand here on the heel of my hand on the greater trochanter. I don't know that this bed is locked. Okay, my thumb is pointing towards his belly button. I've got my fingers, one here, they're going towards the iliac crest and the iliac spine. I'm gonna go right in between them, like right here, okay? Okay, so I'm actually gonna come over here and give it on this injection pad. So then I'm gonna click this green dot on the ceftriaxone. I'm gonna click patient ID. I'm gonna scan him. Then I click the barcode. I'm gonna scan the ceftriaxone barcode that's on the bag. Okay, I'm gonna come over here. I'm gonna clean it off in a circular motion and let that air dry. Okay, I'm gonna pretend like it's dry now. Okay, I'm gonna move the skin to the side for a Z-track method. I'm gonna go in at a 90-degree angle. I'm gonna hold this secure, pull up to aspirate. I don't see any blood, so I'm gonna inject it all. Okay, I'm gonna pull that straight out. Cotton ball. Close my needle, And I can put a bandage over top here. And then I'm gonna put the time. And then I'm also gonna, in comments, I'm gonna write the injection site. I'm gonna click to save it. Okay, so that is all of my medications. So I'm gonna put my patient back into a comfortable position. So I'm gonna lower your bed back down. Mr. Rodriguez, do you want me to put your head back down like you had it?
No, you can leave it up.
Okay.
I'm ready to eat those eggs and bacon.
Oh, I'm gonna give you your tray right before I leave, okay? So I'm gonna clean up all of this. Anything with a needle in it is gonna go into the sharps container. All of this is trash. Okay. Mr. Rodriguez, I'm gonna come back and see you in about 15 to 30 minutes. And when I come back, what I'm gonna do is I'm gonna make sure you have eaten this breakfast tray, okay? If you're feeling bad, I may have to recheck your blood sugar, but I want you to eat the breakfast tray. I may recheck your vital signs for those blood pressure medicines. For all the injections I gave you, I'm gonna come take a peek at the injection site and just kind of look at you, make sure you're not having any like bleeding or allergic reactions or anything like that. Do you have any questions before I go?
No, I'm good, thank you.
Okay, well, I'm gonna take my gloves off and I'm gonna wash my hands and I'm done with my checkoff.